Hello, I'm Dr. Beverly DeValwa. I'm the research acupuncturist at the Linda Jackson Macmillan Centre at Mount Vernon Cancer Centre. I'd like to thank you for taking part in our research into using Moxa to improve outcomes for people undergoing chemotherapy. We've made this video to support you in the processes involved, and I'd now like to hand you over to my colleague, Claire Scarlett, who will take you through the procedures. Thank you.
Hello, I'm Claire Scarlett, the Health Improvement Practitioner from the Linda Jackson Macmillan Centre. We would have already met when you came along to discuss applying moxibustion. We're now ready to begin the procedure. I will now take you through the items that you will need to apply your Moxa. You would already have been given these in your kit. But to begin with, you have a sign which you can, if you wish, put on the door of the room that you're going to be applying the Moxa in, and this is a reminder to people not to disturb you. You'll also have been given a daily diary, and this is very important that you fill it in each day to let us know, hopefully, that you have applied it, but if not, also do make a note if for any reason you haven't. Also, you will have the Moxa itself, an extinguisher, and the lighter that you will need to light the Moxa. Also, we have a timer which you will be setting to 3 minutes for each leg, and a pen to mark the point that you'll be applying the Moxa to each of your legs. Before we start applying Moxa, it's important to remember that the skin needs to be bare. So as well as not having any tights on, it's also to make sure you're not wearing any oils or moisturisers or lotions on your skin. And also to remind ourselves of the important areas for this. So that would be the kneecap, the shin bone, and the crease behind the knee. And so for the kneecap, on some people like myself, these are quite pronounced. You can see here, quite knobbly knees. Yours may not be that pronounced, but if you feel like this, you may well be able to locate where your kneecap is. And then we have the shin bone, which is this hard bone running up the leg there. And then the knee crease is this area if you were to put your thumb behind the knee. And that's because when we're locating the point, what we need to do is put our thumb behind the knee crease, directly under the kneecap, and then we locate the shin bone. We're now ready to mark the point. You take your pen and say, if we start with the right side, so for the right leg, you'll be using your right hand, and what you do is you put your thumb into the knee crease and place your 4 fingers in a straight line directly underneath your right kneecap, and then finding the shin bone, you mark a line underneath your little finger where the shin bone is. So that's about there. And then using your forefinger from the shin bone, you make your point there. And then what we do, where the 2 would meet, is where X would mark the spot. And that's what we have there. Obviously with yourselves, you needn't do it quite so prominent. This is really for you so that you can see where the point is. But for yourself, if you're happy, you can have just a more discreet mark. So as a reminder, also that this is on the side where your little toe is as well. So it's on the outside of your leg, and you have your thumb in your knee crease, wrapped round under the kneecap, 4 fingers in a straight line. On the shin bone, you make your line, and then a 4-finger out from there is where you'd make your mark, and then you have your X marks the spot. And now you're ready to repeat this on your left leg. But we're now ready to mark up the other leg. So for the left leg, we use our left hand and wrap the left thumb in the knee crease, under the kneecap, and then locate the shin bone. You find the shin bone. There we are. And draw a line. And then what we want to do is to roll the finger and make a point the other side. And again, where these two lines would cross, which is there, that's X marks the spot. And as a reminder, it's on the side where the little toe is. So for both legs, put them side by side, we can see the points are there and there on the same side as the little toe. Now we're ready to begin. Step 1 is to set your timer. So this needs to be set to 3 minutes, like so. Step 2 is lighting the Moxa. So you have your Moxa and the lighter. Do lock the lighter and turn it off when you finish with it, so you'll need to unlock it. And also keep the flame at a low setting to light, and then if you need to make it bigger you can do. So have it on the low setting, unlock and light. See, that's flame's plenty big enough on a low setting. And it may take a minute or two, particularly the first time you light a new stick, to actually have it lit enough or warm enough. So be a little patient with it. And you can see it getting white around the outside there. There we are. So that is now ready. Put that down. What we need to do is test the warmth of the Moxa stick, but it's very important not to have any direct contact on the skin with the stick, so do not touch your skin with it, but you can have it a little way away from the palm of your hand, and I can feel some heat radiating off the stick there, so it's ready to be used. Right, we're now going to apply the Moxa. So start the timer and hold the stick a little way away from the point that you've marked. You should be able to feel some warmth coming off of the stick, and it should feel really pleasant actually, but not too close. If for any reason it starts to feel too warm, then just move it further away, or if it's feeling sort of, not as warm as you would have thought you can move it a little bit closer. And again, if for any reason it feels really cool, you could hold it back up to your hand just to check that it is still lit, but it should be fine. As we've mentioned before, it is important not to have any contact directly with your skin with the stick, so just hold it a little way away. And you may notice some reddening of the skin after a while, or maybe towards the end of the 3 minutes. If that does happen, this should sort of fade a little while after you finish the application, so maybe an hour or maybe a little bit longer, but that should fade. This should really be a really pleasant, enjoyable experience. And as we've said, with putting the sign on the door and letting people know that you need a few minutes to yourself, this is a really good opportunity for you to maybe practice some mindfulness and just think about what you're doing and concentrate on the Moxa. Try not to think about anything else. Right, so now we've put the stick down on the extinguisher, stop the timer, and we're ready now to do the same again with the next leg. So once you've brushed off the Moxa, You could then continue to use it for the next leg, or continue with the leg that you're applying to. Do try and avoid tapping the Moxa stick, because that could cause a crack to the stick, a hairline crack, or bits to fall off, which may cause a burn to yourself or any furnishings. Also, please don't put the stick underwater, because it won't extinguish it, but it will ruin it.
Oh, sure.
I'm now going to show you how to extinguish your Moxa stick. So you can put it directly into the extinguisher that you've been given, or if for any reason you can't find it, alternatively, you can have half a jar of salt, such as this. This is normal table salt, and use that to extinguish your stick with. So what you do is you tilt it onto its side, and then you take your stick and you put it towards the top of the jar, and then tilt it upward like that, and that will also do the job. Now you've finished applying Moxa to both of your legs, it's time to fill in your daily diary, and this is something that you should do each day, including if for any reason you've missed a day. Please do fill it in and maybe make a note of why you haven't done it that day. So please do the daily diary, and then you pack the kit away. It would be better perhaps if you could keep everything together. We do have the bag that you were given your kit in, so you could keep everything in here. Although with the Moxa sticks and the extinguisher, you could keep that like that, and that would be perfectly fine. Maybe find a shelf where you could put this next to the bag to keep it together, and also that way you can keep it out the reach of children or indeed anybody else. You may also find that from time to time the extinguisher will build up with ash, and you'll know this because when you put the stick in, it won't maybe stand so firmly within the holder. And so to clean it out, all you need to do is take a pencil and a piece of paper and sort of poke around quite firmly, really, in the bottom of the extinguisher, and you can remove the ash. Maybe do a little bit more. There we are. And then that can just be thrown away. And you can stand the stick back in. There, it fits in much better now, and put that away. I'm now going to give you some aftercare advice for the rare possibility that you may have a burn. This information is also available in the booklet that you've been provided with, but just as a reminder, if the area where you've been applying Moxa is excessively red or sore, or if there's a burn, you can either put the leg under cool running water for 10 to 20 minutes, if that's something that's comfortable for you to do. But if it's not, you can sit with a bowl of cool water and a compress and keep applying cool water to the area for again 10 to 20 minutes. You can then cover the area with a non-adhesive, non-fluffy sterile dressing, and for this you could use cling film, or you could use a lint-free dressing such as melanin, and this is available at all chemists and also some supermarkets. If the area has a deeper blistered or pale or blackened appearance, then you should seek medical advice, and that would be after going through the process already discussed with the cool running water or the compress and dressing the area. If the area is a burn of bigger than the size of a postage stamp, then it is important that you do seek medical advice. And also do not use any oils or lotions or ointments to the area. And if there is a blister, please don't break the blister. Thank you very much for watching. I hope that you found this useful and that you find using Moxa a pleasant experience. If you would like any more information or would like to contact me, my number is in the information booklet that you've been given. Thank you.